We'll get to quickly look at bilateral renal stenosis. So, bilateral renal stenosis just simply has to do with there's a narrowing in the renal artery. That's the artery that actually takes blood supply to the kidneys. So, when we say something is bilateral, it's on both sides. Bi is two, lateral sides. Okay, so the two kidneys have this narrowing. And of course, if you have a narrowing on one side, it should be fine. It's less threatening. But if you have narrowing on two sides, I think this is when you have an emergency. You get. So it just refers to narrowing of both renal arteries. And these arteries are arteries that should actually supply blood to the kidneys. Good example of a bilateral renal stenosis. So there's narrowing on both sides. You know. So it's a serious cause of secondary hypertension. So hypertension meaning that blood is not efficiently being pushed into the kidney so that fluid and waste is put out of the body, but a lot of it is being retained back into the body as a result of the obstruction. You understand? So causes could be atherosclerosis where there is buildup of fat. Okay, plaque, people that have high fat, bad cholesterol, and low density lipoproteins. Then also fibromuscular dysplasia. That one is more of like a muscle issue. Okay. So pathophysiology is the narrowing is what will now reduce the amount of blood that will be reaching the kidneys. So there's low blood reaching the kidney. Okay. So the kidney will feel as if it's actually an issue of low blood. Do you understand? So to now activate the renin angiotensin aldosterone system. This system will further cause the blood vessels to constrict. So in bilateral disease, both kidneys are affected, and the risk of you having bad things coming up is more. Okay, so clinical features is what you have a hypertension that is resistant. Even if you are given a lot of drugs, it's resistant to therapy. You know, then sudden worsening of previous stable blood pressure. So the blood pressure could be stable the other time, but it's actually worse now. You know, then abnormal bruit, that's whooshing sound over the renal arteries. Then the kidney function will be declining so fast. Okay, because sometimes if one kidney is affected, one can be standing in for it. But two kidneys are affected, you have it. The patient is what's going down so fast. They will have also the flash pulmonary edema. So you diagnose this using the Doppler ultrasound of the renal arteries, CT angiography, MR angiography, and also what is known as a captopril renogram. So medical therapy, this is where you do all those blood pressure controls with antihypertensive. You know, you use statins and antiplatelet agents. You use the percutaneous. This should be like related to surgery. So percutaneous transluminal renal angioplasty, then renal vascularization in persistent cases. So I think this is what we have in selected cases. Okay, this is what we have for this bilateral renal stenosis. Just so you know, it's an emergency. If you have a blockage on one side, it's better than you saying you have a blockage on both sides.